Hello and good morning, everyone. In our today's discussion, we are going to see the drug treatment of PUD, peptic ulcer disease. Generally, we have four approaches in the treatment of peptic ulcer disease. Approach number one is acid neutralization, that is rendering the already formed acid inactive. Approach number two is the blockade of acid production, to completely block the acid production. Approach number three is eradication of that notorious bacteria, Helicobacter pylori. Approach number four is strengthening the GIT defensive lining. Now, all the drugs that we're going to discuss on that PhD, they work through one of these mechanisms or one of these principles. Class number one are called antacids. Antacid or antacid drugs that work against an acid, and by default, these drugs are basic in nature. If we remember our basic chemistry, there is a reaction that is called neutralization reaction, which is a reaction between an acid and a base to produce salt and water. It is a direct process of rendering acid inactive. In PUD, we have excessive acid production in the GIT. Therefore, we give a base to neutralize this acid, thereby rendering the acid inactive. These drugs, they give an immediate relief. That's the beauty of antacids. They give immediate symptomatic relief. Whenever the patient is having acute symptoms of PUD, then the drugs of choice should be probably antacid. These drugs, they should be shaken before use, because most of them, they come in form of what is called suspension. Make sure you shake them thoroughly before using them. These drugs are preferably taken postprandially after taking meal. Reason being, studies have shown that acid production is more after taking meals, and therefore these drugs produce their best effect after taking meals. These drugs, they have wide patient coverage. They can be used by almost all category of patients, including pregnant women and children, because of their less side effects. These drugs, however, they have high chances of drug-drug interaction, and therefore they should not be combined with other medications. They should not be used together with other medications. These drugs, they have GIT side effects and systemic alkalosis. Some of antacids are not absorbed. They only work locally in the GIT, like aluminum hydroxide and magnesium hydroxide, and therefore these ones that work locally, that are not absorbed, they cause either diarrhea or constipation. While those that are absorbed, those antacids that enter into the blood circulation, they stand a big chance of causing systemic alkalosis. Remember, they are basic in nature, they are alkali in nature, therefore they stand a big chance of increasing the blood pH. Thank you so much, and see you next time. Bye.